It's the Russian style. Whack, 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 whack.
The lymphatic movement, huh?
Yeah.
A good Catholic.
Yeah.
Ooh.
Welcome to Journal Club in the Sauna. Stefan Hartman, Iron Direct Primary Care, and we have Justin Chamberlain, Nurse Practitioner, here to bring us a really cool subject that has affected him personally.
National soccer coach. And through that, I always trained my athletes. This is pre-puberty. We don't have a lot of injuries, but once puberty happens, we have a change in hormones in our female athlete. And, we're going to share some research and do the Journal Club. For anyone who wants to look it up, it's the effect of menstrual cycle and contraceptives on ACL injuries and laxity. Recently, it's a meta-analysis of 70,000 people. Is that female athletes, especially as they're crossing into puberty, need to be aware of what happens in mid-cycle, which is the estrogen spike. And that leads to the laxity or the looseness of joints, in particular, one that takes a lot of weight in soccer, the knee. The first 14 days post-cycle is when women will have these injuries. Because during that time of that progesterone, by the way, women have testosterone. It's always in their body. They actually have more testosterone than estrogen or progesterone, which is something interesting. While not the level of men, where we're about 10 times probably the average woman's testosterone level, not all men, but some. So with that, they get great muscle response. It's a great time to work out. It actually decreases dysmenorrhea and going into that. But when we see this estrogen spike, all of them came together and they all found that in that pre-phase, post your cycle, post your menstruation, there is a high risk for injury. So with that, we start to say something, and it's not a difference of men versus women. Men just have a 24-hour cycle with the testosterone.
Yeah.
So it's easy. Men you would say might have a higher risk of injury maybe in the evening. I'm not sure, but I guess with testosterone it doesn't matter. But with women, it is very important, and I think there should be a push, and apps have the ability to be more aware of your menstrual cycle, and people should be, especially with our preteen athletes, who now, as you mentioned, that the quad hamstring imbalance, which happened with a huge growth. So let's say a young girl going into 7th grade grows 8 inches that year. So her muscles become elongated. She lost tons of muscle strength she had in her 5th grade before she entered into this to menses. And now all the pressure's on her knee.
Wow. Because that muscle hasn't developed. That muscle stretched. Stretched.
Yeah. And we're just leaving on its own, and they're all tearing their ACLs, and we're like, oh, well, sorry about that. But we know this and we don't put it into practice. So
explain this again. So what did they find in the data? When did they exactly tear it most? Was it during the post-menstruation or was it during post-menstruation? Yeah. So this is when they have the lowest estrogen and progesterone.
Yes.
Okay.
Into the estrogen spike, right? So we have 4 different studies saying the estrogen spike. 3 of them saying, anywhere in there. Once again, this was done with saliva tests, blood tests, different tests, and added to which this was based on athletes. Remember, athletes can miss a menstruation, so the irregularity of female athletes played into it. So there is some stuff to kind of work out and iron out. But when you have all meta-analysis is finding the same thing, which is in the pre-phase, so pre-progesterone release, we have something going on.
Wow, so all of these studies are finding that none of the injuries are happening during the luteal phase?
None. And that's in 70,000 female athletes.
But estrogen does peak in the luteal phase. Well, then that would be because maybe progesterone is balancing the estrogen?
Exactly.
Okay.
And progesterone, once again, is when you're going to get those gains. So women who do want to put on maybe more hypertrophy or more muscle growth prior to their menses would be the time, right? And you want to increase your protein and do those things. So yeah, just powerful to be aware of it. Putting it into practice is the difficult part, because once again, our current sports world isn't really going down the road of being aware in female sports, of their menses and when they step into that. But it would certainly be something that should be done with these high performance athletes.
They're talking about oral contraceptives here and how that influences it?
So once again, the reason they're going to talk about oral contraceptives, which is a big issue in this world, and we're not going to get into the side effects because there are numerous side effects from oral contraception. But once again, if you start to give a baseline dose of progesterone, you will have a positive effect, that being possibly a decrease in ACL tears.
Okay.
That's with a balanced estrogen progesterone type of
yeah. Did they talk about the progesterone only ones too?
I don't know if they separate that out. I can't remember. I'd have to do a little deeper dive.
They often don't.
Yeah, I will say once again, though, the biggest question mark is then once again the side effects of, synthetically made progesterone. What you think about that versus bioidentical, and there's a lot of stuff to get into when we start to discuss hormone
So
therapy with minors.
21 studies totaling 68,000 participants were included, 5 on the menstrual cycle and ACL injury, 7 on hormonal contraceptives and ACL injury, as well as 13 on menstrual cycle and ligament laxity. 4 of 5 studies of women not using hormonal contraception indicated that the luteal phase was the least associated with ACL injuries. The 2 largest and highest quality studies on hormonal contraceptives suggested that hormonal contraceptives may be protective against ACL injury. 6 of the 12 studies on ACL laxity provided quantitative data for meta-analysis, finding significantly increased laxity during the ovulatory phase compared with the follicular phase. The ovulatory phase is when they're going to get that spike of estrogen, but there won't be any progesterone associated with that.
Right.
Wow, so it's the progesterone that's protecting them.
Progesterone is a protector, which we even see, I think, right, let's go into menopausal and postmenopausal women. Progesterone continues to be that balancing.
It is. We know it's neuroprotective. I hadn't considered it as joint protective as well.
Yeah. Maybe even getting into the result of decreased, we do see a decrease with estrogen, once again, of bone density, right?
Yeah, of course.
So then keeping the muscle with progesterone along with it too. Most of the studies I see talking about, the use of hormone therapy would be during menopause, perimenopause into menopause, and maybe 10 years into post. But, further out, I don't know why there wouldn't be a benefit, but anyway,
estrogen definitely is joint protective. We see that in men all the time. So if you've got men, you give them too much, anastrozole, and they crush their estrogen too much, they'll be complaining of joint pains.
Sure. Yeah.
So it is joint protective.
Yeah.
But then for the female, when there's that imbalance, like too high estrogen, not enough progesterone, at least if it's a cyclatory, if it's just in the ovulatory phase. But also I see a lot of women with estrogen dominance. So they aren't actually cycling their progesterone as they normally should be.
Yeah.
They have super high estrogen, no progesterone. So these women would be at risk too of the injury.
Absolutely. Yep. Or estrogen overload. And something I think with men too, we have to realize is why is the body with aromatization already factoring in with the overuse of testosterone and spilling that over to estrogen?
Body's smart.
Body's smart. Evolution's smart, right? We're here for a reason.
Yeah. It's trying to protect you.
It's trying to protect you. Yeah. So when you start having that, is that where men should maybe wake up and say, okay, I know I want the feel or the maybe neurological response of high estrogen or the confidence.
High testosterone.
Yeah, but yet lowering the testosterone would probably be more beneficial for them physically.
Or in the last conference, what they suggested was if you have a guy on high testosterone and you see high estrogen in the blood work, don't necessarily treat it, like leave it as be, because we know that's protective again towards collagen and improves elasticity. Where does it improve elasticity? In your arteries. It improves the pliability and relaxation. Or we know that heart disease, the main driver of that is arterial wall hardening, hardening of those arteries.
Yeah.
The estrogen is protective against that.
Yeah. Interesting.
Right? And so why do women overall have less heart attacks than men? Right? It's because of estrogen. It's protective in their arteries. And why do they start getting it at some point in their life? It's because they lack estrogen. During menopause, the estrogen shuts off.
Boom.
Gone. You don't get it anymore. What happens? Heart attacks go up. Strokes go up. Right?
Yeah.
Giving back the estrogen is protective, not only for men, but for women. Or not only for women, but for men too.
Yeah, absolutely. Yeah. And once again, hormones is a piece of the puzzle. We always look at cortisol levels. We look at all stress factors, diabetes, sugar. But if there is a factor that you can be aware of and that we have information that's growing, continuing to support the health benefit of estrogen, other than your ACL tears with young kids. So once again, how do we cure this with young children is one, being aware of it, two, your quad to hamstring ratios, building that muscle, nose over toes training. We were just
knees over toes,
knees over toes, yeah. So
I love that stuff. It's so good to improve the insertion of your quadriceps into your knee, strengthen it. So I'll do bridge runs backwards here on the causeway.
Absolutely.
Yeah.
I
do the knees, long knees way over the toes. I'm starting to do slant board deadlifts, like deficit curls, like going way low.
Let me ask you then, when you talk about like a hamstring curl, so people will talk 1-to-1 ratio, so whatever you can do for, what is that called, a curl as well, right? A quad curl, I guess.
Yeah.
Or a quad extension. you want that weight to be equal what you can do on your hamstring, or as close as you can, because hamstrings generally aren't as strong as your quad.
No.
But what is kind of a good goal you think to kind of get to when you start talking about quad extensions?
Ideally, I want to be able to do the Nordic curl. So I want to be able to pull myself up by my own hamstrings.
Okay.
Yeah, I want to be able to do that.
And a benefit for that is if you ever fell down, you could pick yourself up. I mean, that's a pretty good goal.
I've torn my hamstrings now like twice in tennis tournaments.
Okay.
And why that might be, it would both happen on clay courts, but it might just because my hamstrings are weak. Yeah. My quads are a bit stronger.
Yeah.
So I'm going to try.
Dominance.
Yeah.
So once you get tired, probably further on in a match, you would have a tear.
Yeah. Yep. So I'm going to work on that some more.
Yeah. Yeah. Absolutely. So I see that a lot. UCLA, there's a great soccer coach out of there years ago. Probably, I want to say Amanda, I can't remember her last name right now, but gave that information out and saw that to the point where UCLA, this is a top tier, probably the #1 NCAA Division I women's soccer team, getting down to 0 ACL tears.
What? By doing what?
By doing a 1-to-1 ratio quad to hamstring, and the weight to decipher the quad was your own body weight. So you need to be at least able to do your own body weight. Obviously, in elite athlete, you're going to be above that.
In what? Squat? Leg
Just
extension?
a leg extension. So that was the metric being evaluated.
To do your own body weight in a leg extension? What about the curl?
With 2 legs, by the way, not single leg.
Okay.
2 legs. So not a unachievable goal.
But what about the curl, the hamstring curl?
You would ideally want to get as close to, so I've heard 80% or greater, but close to 1-to-1 as possible, where your hamstring may be a little weaker. But
okay, yeah, I can do that.
And because your quad is your original engager, so when you're in your sprinting and everything, not till you get tired, you need the stabilizer, right? So you're going to lose your speed just because of the length of the match in tennis or whatever it is, but the stabilizer muscle has to be able to then kick in and support. So it makes a huge difference. And ideally, I think the most important thing we all know is avoiding injury, because if you do have injury, you're done. So you're on the sidelines.
And what are you going to tell your daughter?
So anyway, just so everyone out there knows, I did have a daughter. She tore, I love my daughter Bella, and she tore her ACL once, which happens. She was at that age. Dad was a soccer coach. It was my first year. I took off coaching to let her experience her teen years. And coach had a different philosophy than me. I have a full believing of what FIFA shares as the I-9, which is, the hamstring strengthening drills before every practice, especially for that age group. They didn't believe in it. They were doing static stretching and a 2-mile run. So she tore. So funny, the coach who's so adamant about it would pay the price, and a hefty fee. I mean, it dropped more than $30,000 on ACL reconstruction. But the beautiful thing was a young child, and seeing how hard it was for them to then, after an injury, train. And she got to 5 months, although doctors encourage a year, by the way, for the best results once you do an autograft. So placing that graft into your knee, where they pulled it from the hamstring and placed it into the ACL, anterior cruciate ligament. And during that time, she got more confident, went down to a soccer field, started playing, and just tore it again. So I will give her credit, though. She's at 1 year and 3 months now, post her second surgery, and she's a beast. She's throwing weights around like no one's business. Made her a better person, but it was a painful experience for a young girl who was so serious about her soccer. So I can tell you the future is very bright for her, because she's going to be able to refocus on that now. And now she brought in something which probably was more important, which is her ability to maintain health and strength. And if people don't know, over here at Iron DPC, as providers, our #1 focus is proper nutrition and proper exercise, and sleep, always as a metric. But there is nothing more functional than that. Yeah.
Well, cool. That was a great study. We'll continue to do these. Thanks for joining us at Journal Club in the Sauna.
See you soon.